So, one of the terms that's out in the press is this issue of commotio cordis, and commotio cordis is a sudden traumatic blow to the chest. Typically, this comes from a sport like baseball or ice hockey or something where there's a projectile lacrosse going very rapidly, greater than 30 or 40 miles an hour, and hitting the left side of the chest. If the heart is sort of stimulated at the wrong moment in time, there's a very vulnerable period when the heart is kind of recovering electrically. And if you stimulate it at that wrong period of time, that 1 in a million thing, you can suddenly go into an abnormal rhythm. So it's hard to know how often that happens, but there's probably no more than 20 or 30 cases of that reported a year. So while commotio cordis is a possibility with this scenario, certainly he was hit in the chest by a helmet. It wouldn't, if you looked up commotio cordis and read a bunch about it, almost all the cases are in younger people, and they're also reported from projectile sort of hits to the chest. Clearly, I think he likely had an arrhythmia. And so if you look at other causes of sudden rhythm changes of the heart, that's what they're going to look into over these next few days and weeks. And that's what we look into when somebody drops in our community, because we want to make sure that they didn't have an inheritable condition, something like hypertrophic cardiomyopathy, or an inherited rhythm condition like long QT syndrome or arrhythmogenic right ventricular dysplasia, or these fancy words. And all they mean is that you're susceptible to a sudden rhythm change of your heart. Some of those can be hereditary, some of them can be acquired. And I think that's going to be a part of anything that goes on going forward. And that's what all of our doctors and all of our communities do every time we have one of these devastating cases, because certainly you want to make sure that there wasn't a family history or something that potentially is hereditary that could affect other members of his family or any family for a child or a young athlete that drops doing sports participation.